Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner on call is asked to evaluate a 21-year-old male who was just arrested following an altercation at a local bar. The patient has never been incarcerated before, and there is no psychiatric or medical history available. His toxicology screen was negative for alcohol or any drugs of abuse. His mother is available, and she reports that in the past he has had some episodes of agitation, but this is the first time it's been a problem. Reportedly, he and some coworkers were at the bar celebrating a birthday, and before anyone knew what happened, an argument appeared to escalate. The patient became very loud, was yelling and acting crazy, began breaking bottles, and finally punched a coworker. When considering a manic or hypomanic episode, the psychiatric mental health nurse practitioner expects that his speech would most likely be characterized as A. Stuttered, B. Increased, C. Childlike, or D. Confused. So the first thing you want to consider is the character of this question. You know that your questions will break down into the typical ADPI nursing process: assessment, diagnosis, plan, intervention, and evaluate. And this question is giving you some assessment information, and it's asking you to make an educated guess as to another assessment finding. It's asking you about what you would anticipate as the character of his speech. So this is an assessment question. And what you really want to do is focus on the question that is being asked of you and the 4 answer choices. Very often, more than one answer choice could work. And just as often, sometimes the answer that you might think is the correct answer, the thing that you look for among the 4 choices provided, is not there. And so you have to look at the question, look at the 4 answer choices, and pick the best answer from among those provided. So this question gives you a fair amount of background. There are several sentences here of information that support perhaps a manic or hypomanic episode. Mom says that there have been some episodes of, quote, agitation in the past. We don't really know what that means, but we know that today he's become so agitated, he escalated very quickly, he was crazy, breaking bottles, and finally punched someone. But most importantly, the last sentence tells you, when considering a manic or hypomanic episode, the psychiatric mental health nurse practitioner expects that his speech would most likely be characterized as what? So you do want to make sure that you zoom in on what the question is asking of you, particularly in circumstances where you have several sentences here, where a lot of information is provided. All of the information matters. And as you put all of this information together, it may very likely be consistent with a manic episode. He's the right demographic, the toxicology screen is negative, he has a history of some agitated behavior, this circumstance appears to escalate. All of that is very consistent with a manic or hypomanic episode, and it culminates in the final sentence wherein the question asks you, when considering a manic or hypomanic episode, you expect that his speech would be most likely characterized as what? So I think we can all agree that we are looking for the speech pattern that would be most consistent with a manic or hypomanic episode. You know, speech is it's an important assessment finding in psychiatric patients. Speech is typically described in terms of fluency. We will refer to the ease of flow, if the fluency is normal or fluid, or does it appear to be stuttered or stagnated? We describe speech in terms of rate, whether it's very slow to rapid or pressured. We will describe speech in terms of volume. Sometimes patients speak distinctly, very softly. Other times it is too loud for the circumstance. And we even describe intonation. Is there a normal prosody? Is there a normal range of inflection, or is the speech just flat? So there's lots of things that we use to describe speech. But as you look at these 4 answer choices, which is most consistent with a manic or hypomanic episode? And the answer is increased. Now, it might not be what you would look for. I would look for pressured. When I read a question like this, I would be looking for pressured or rapid to be in the answer choices, but it's not there. So I have to pick from amongst the best of those provided. I wouldn't necessarily expect stuttered speech in a patient with a manic or hypomanic episode. Stuttered speech would be more consistent with things like social phobias or anxiety. Childlike speech may have many potential causes, but is most often associated with personality disorders. And confusion, it might occur with a manic episode, but it wouldn't be the first thing that we look for. Confusion is really much more consistent with neurocognitive or psychotic disorders. So while there are a variety of reasons for pretty much any of the speech patterns described here, the best answer to this question from among the 4 answer choices provided is B, increased. Because in a patient with a manic or hypomanic episode, it would be very typical to observe that speech is pressurized, rapid, escalated, a louder tone, exaggerated prosody, and all of those are more consistent with increased than anything else that is offered here.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit fhea.com.